Welcome to MediMobile's LinkedIn Live demo of Genesis, our AI-powered solutions for automating revenue cycle management. My name is Christy Clark. I'm an account manager at MediMobile. I'm proud to be a part of a team leading innovation in the medical coding space. Our mission is simple: to help providers, coders, billers increase revenue and to work smarter, not harder. And 2025 is the year of automating your RCM, and today we are showing you how Genesis can do just that. Stick around after the demo for an interactive Q&A session with Lauren Hall, our Director of Business Development. Feel free to drop your questions in the chat at any time. Now let's get started on some background on how Genesis works for you. You might be wondering, how does Genesis work with your existing system? Genesis pulls data from the documentation already being captured in your EMR, such as patient charts, visit notes via ADT and MDM feeds. Our solutions integrates with your EMR or your practice management software, extracting the necessary information in real time. Then it uses that data to provide accurate, actionable coding recommendations. It's completely secure, works behind the scenes, and integrates with your current systems. Let's take a look at how it works on a live demo. All right here you will see that I am signed in to our demo account. It will show the provider's name in the top right-hand corner. Right next to the name, it's going to have our built-in messaging icon tool. So if you needed to utilize that to message your providers, you're able to do so. You can use it to message your colleagues, billers, admins. If you needed to send a message to someone that does not utilize the tool, you would simply send the message, and it would send them a notification to let them know that they have a message waiting for them in the MediMobile app, so they can download the free messaging tool. All right, now right here it tells us that Dr. Stacy Astor has 5 encounters for today's data service. I can click anywhere in that circle and it's going to bring up those encounters. Right here you will see that it shows us the patient Olivia Smith for the data service of today, 12/11. The MRN was transferred over from the EMR as well as the facility information. If an account number had been provided, that would be shown there as well. The system was able to read the provider's documentation and code accordingly. So the provider simply needs to come in and approve the bill. All right, here's the next one. Charlotte Williams, same thing. Data service came over, MRN number. That one we did receive an account number, and of course the facility information. If we need to go back and reference the documentation that was made by the provider, we simply can click this right here, and we can read the documentation if need be. Right here is our scoring guideline. It lets us know the provider's documentation did score well enough that the system was able to make those coding recommendations, and the provider simply needs to come in and approve the bill. Now, you'll see right here that it does turn it to a different color, and it shows us that this bill is complete. So nothing else is going to be required to be done from the provider at this point, because it will auto-confirm off to their billing team after 48 hours. That time frame is completely customizable. When you're getting set up with our software, you would work with your implementations team to figure out what time frame you want to utilize. The most common one we see is the 48-hour turnaround time. Let's see here. If maybe we were a bit behind on our billing and we needed to go back to previous date, we can either use the arrow back or click on the word today, and it will bring us up the calendar. So for an example, maybe I was a bit behind on my billing and I needed to go to Friday, December 6th. I could do so. It brings up those 5 encounters. Same thing right here. Information was transferred over, and I can simply come in and approve the bill. Now that bill has been approved and is waiting to be transferred over to my billing team. We'll take note right here, this one for Sophia Davis, just a bit more information is going to be needed. Right here, this one, we need to simply make a refinement so that we'll be able to approve the bill. And just with a few simple clicks, I can hit the word change, and it brings us up our refinement tool. After we provided a little bit more information, then it will update that code and let us approve the bill as well for that one. These are rules that can be set in place by your organization. This would be completely customizable. So if based on a code that the system picks up, if you wanted to ask an additional question, it can do so, such as we see here. It's simply asking me if we obtained, reviewed, or updated the patient's current medication information. I would just acknowledge that I have, and then it's now a completed bill as well. I'm going to go ahead and tell it to go back to grid. And the other widget that we see here on our homepage is going to be, on our dashboard, is going to be the active list confirm versus unconfirm widget. I can click anywhere in the blue circle, and it's going to bring us up all 11 bills that Dr. Stacy Astor has. Like I said, nothing else is required to be done at this point. However, maybe I'm a bit behind on my billing and I need to get that off to my billing team as we're approaching the end of the month. Just with a few simple clicks, I can do so. By coming here, checking all those charges, and hitting confirm, those have now gone off to my billing team. I'm going to tell it back to grid. I want to take a minute to show you our reporting system. We do have a pretty robust reporting system. There's lots and lots of different reports here, from billing reports, census reports, and charge analysis, and many others. So definitely work with your account manager if there is a report that you are needing to track metrics on, and we can see if it's a report we already have or if it's something that can be customized. And to summarize, Genesis is more than just a coding solutions. It's your complete automation partner for RCM. Now let's welcome Lauren Hall, our Director of Business Development, and dive into your questions. Welcome, Lauren.
Hi, Christy.
Hello.
Hi, Christy. How are you doing?
Good, and yourself?
Fine, thank you.
Good. First off, what are the biggest challenges Genesis addressed in automating RCM?
So with Genesis, organizations can look forward to not only time saved, but an increase in revenue and a decrease in the number of denials they'll see. With Genesis, providers are saving 10 to 20 hours per week, not having to manually code their encounters. Along with the provider saving time, your billers and coders are saving about 75% of their time previously spent searching through documents and adding CPT and diagnosis codes. So those resources can be used elsewhere to tend to things that maybe were overlooked just because of a lack of time. Because we're able to add the CPT and diagnosis codes for the providers and save everyone time, those encounters are going out a lot faster with a lot more accuracy. Mm-hmm. So denial rates are going down because what's being documented is reflected in the coding. So you don't have to worry about that mismatch that sometimes occurs. And then that decrease in time spent getting the CPT and diagnosis codes onto the bill and then sent out, that decrease in time results in a faster turnaround time for your increased revenue.
Awesome. Okay. How does Genesis integrate with EMRs and other systems so easily?
So we have a dedicated integrations team here at MediMobile that works with facilities, HIEs, all the different places where you can get those ADT, which are the admit discharge transfer feeds, which contain the patient demographics and insurance, as well as the MDM feeds, the medical decision-making feeds, or the notes that the providers enter within their EMR. So our integrations team works with the facilities integrations team, or the entity that's providing the feeds, to set up the feed to come into MediMobile, and we then use the medical documentation along with Genesis to add those CPT and diagnosis codes to the claim. Our integrations team will work closely with your team to initiate the process. The facilities typically do want that initial contact to come from the group, but we provide everything you need to reach out and begin that process. And from there, after the initial request, we take over and we set up those feeds.
Awesome. Okay. What makes Genesis the leader in RCM automation for 2025?
So our accuracy rate is above most within the industry. We have a 95% accuracy rate with our coding, and that right there sets us apart. But The consistent updates and features that we add to MediMobile as an overall platform significantly set us apart from our competitors. We're constantly innovating and adding new features to our system. And one thing to note, I know this comes up a lot on demos, is how do we make sure that when codes are retired or updated, that those updates go into effect on time. So what our team does is as soon as we get the information regarding the updates or retirements of codes, we go ahead and we add that to the system. So if bills are created for the specific date of service when those go into effect, nobody has to worry about inaccurate coding because of retirements or updates. So our dedicated teams that work with our AI are ahead of the game there.
That's awesome. Yes, ma'am. From your perspective, what's the number one benefit of automating medical coding with Genesis?
Revenue. So you are saving your providers 10 to 20 hours per week, which means they can see more patients or they're able to spend more time with their patients. And then the amount of time it takes to get a bill out the door is significantly decreased because those CPT and diagnosis codes are automatically added to those bills as soon as we receive that documentation. If we have that insurance feed, that ADT feed, which has those demographics and insurance information, you can get that bill out the door the same day, significantly decreasing the amount of time it takes to get your bills out, meaning that you're going to see that return in revenue a lot faster. The other very important piece regarding revenue is we see a lot of our customers are actually missing out on billing out all of their encounters. So we're able to catch encounters that maybe previously weren't accounted for. So that increase in revenue is not just seen in the time frame it takes to recoup the revenue, but also just a general increase because we're catching encounters that maybe hadn't been caught before as billable.
Awesome. Okay. Can you share how organizations measure ROI with Genesis and what results are they seeing?
Obviously, again, it's revenue. So our customers are seeing that increase in revenue, a decrease in the amount of time it takes to get bills out the door, also a decrease in denials. They tend to see these results in under 3 months, just depends on the size of the organization and the documentation. But we work very closely with the groups to ensure that we have all billable encounters, utilizing the document types and such with the group. And that return, again, is typically seen in under 3 months.
That's awesome. Great. We have some additional questions from our audience. They want to know, can Genesis handle high patient volumes in a fast-paced environment like an ER?
Absolutely. So we are currently working with some emergency groups with Genesis, and it's important to note that these feeds are real time. They're HL7 interfaces. So as soon as we receive the documentation after Genesis has been set up, we can go ahead and we can assign those CPT and diagnosis codes almost instantly to the bills. So it doesn't matter how many are coming in, we'll be able to code them.
Awesome. Okay. Next question. How quickly can a new clinician get up to speed with using Genesis?
So we require 30 days for a new build. And while we're building, we will be requesting the feeds. And the time it takes our system to learn the documentation is anywhere between 30 to 60, sometimes 90 days, just depending on the complexity. But we make sure to keep the customer updated. And again, we work with the customer to identify the specific templates that the specific documents that the providers are using within the EMR for our coding.
Awesome. The audience would like to know, is there a mobile version?
There absolutely is a mobile version. We're MediMobile. Of course we have a mobile version.
Awesome. Okay. Last question. How does Genesis handle new medical procedures or evolving clinical guidelines?
So we talked about that a little bit earlier. So anytime there are updates to coding or retirements of codes, of course, we're made aware of it in advance, usually a couple of months. And so what we do is we go ahead and our team of engineers builds that in. So on those effective dates, you will either see those updates or the deletion of the codes based off of your bill's date of service. Of course, if groups are back billing, which, we can obviously expect maybe a day behind or so, our system recognizes that date of service to allow for those codes. But in terms of adding retired codes or codes that have updates after that designated date of service that is set forth, then those codes will no longer be available.
Awesome. Thank you, Lauren, for sharing your insight, and thank you all for joining us today. If you'd like to learn more, schedule an additional demo, or request pricing details, simply fill out the form in the chat or visit MediMobile.com. You can also reach me directly at christyc@medimobile.com. Don't forget to follow our LinkedIn page for updates on upcoming live events and podcasts. Let's make 2025 a year of RMC automation, starting with Genesis. Thank you all for your time today.